Fatigue is something most people experience occasionally, but when it becomes sudden, intense, and doesn't improve with rest, it can be a serious warning sign, especially for seniors. Our bodies naturally tire after exertion, but persistent exhaustion that comes on without reason is your body's way of signaling that something is wrong internally. This type of fatigue is not just feeling sleepy or needing a nap. It's a deep, overwhelming weakness that makes even the simplest tasks, like standing, walking, or preparing a meal, feel like climbing a mountain. One of the key concerns with sudden severe fatigue is that it can indicate serious underlying health conditions. Heart problems, such as heart failure or arrhythmias, often manifest as extreme tiredness because the heart struggles to pump enough oxygen-rich blood to the body. Similarly, chronic lung conditions like COPD or pneumonia can starve the body of oxygen, leaving seniors feeling drained no matter how much they rest. Fatigue can also be linked to metabolic or blood disorders, such as anemia, which reduces the oxygen-carrying capacity of the blood, or diabetes, where unstable blood sugar levels can sap energy rapidly. It's important to pay attention not only to the fatigue itself but also to other accompanying signs. If fatigue is paired with dizziness, shortness of breath, irregular heartbeat, or fainting, it becomes even more urgent. These symptoms together may indicate a life-threatening condition that requires immediate medical attention. For seniors, even small declines in energy can significantly affect quality of life, increasing the risk of falls, accidents, and other complications. Ignoring sudden severe fatigue can be dangerous. Many seniors dismiss it as a normal part of aging, but when fatigue is persistent and unexplained, it should never be overlooked. Keeping a log of energy levels, noting what triggers exhaustion, and seeking prompt medical evaluation can help identify the underlying cause early. Early detection and intervention can sometimes prevent serious complications or even save a life. In short, sudden, severe fatigue that doesn't improve with rest is more than just tiredness. It's a crucial signal from your body that something may be critically wrong. For seniors, staying alert to this symptom and taking immediate action could make the difference between life and death. Never underestimate the importance of your body's warning signs. Fatigue is not just a nuisance, it could be a lifeline alerting you to seek help. Unexplained weight loss is more than just a change on the scale. It's a critical warning sign that something serious may be happening inside the body, particularly for seniors. While intentional weight loss through diet and exercise is generally healthy, losing a significant amount of weight rapidly without trying should never be ignored. For older adults, even a loss of 5–10% of body weight over a few months can signal underlying health problems that require immediate attention. Rapid weight loss can result from a variety of serious conditions. One of the most concerning causes is cancer. Tumors can alter metabolism and appetite, leading to significant unintentional weight loss. Digestive system issues, such as ulcers, care and vigilance that could literally save a life. In short, unexplained and rapid weight loss in seniors is a powerful warning sign that demands attention. It's the body's way of signaling that something serious is occurring internally, and early intervention can make all the difference. Never ignore sudden changes in weight. Listen to your body, seek medical guidance, and act promptly to protect your health. Shortness of breath or chest discomfort is more than a minor inconvenience. Especially for seniors, it can be a critical warning sign of life-threatening conditions. While occasional breathlessness after climbing stairs or exercising is normal, persistent or sudden difficulty breathing, tightness, or pressure in the chest should never be ignored. These symptoms are the body's urgent signals that the heart, lungs, or circulatory system may be under serious stress. One of the most common causes of shortness of breath and chest discomfort in seniors is heart disease. Conditions such as heart failure, angina, or arrhythmias reduce the heart's ability to pump blood efficiently, depriving the body and vital organs of oxygen. This lack of oxygen triggers fatigue, dizziness, and difficulty breathing. In some cases, chest pain may be a sign of a heart attack, which requires immediate emergency attention. Even seemingly mild or intermittent chest pressure should be treated seriously, as heart conditions can progress quickly and without warning. Lung problems are another major contributor. Chronic obstructive pulmonary disease (COPD), pneumonia, pulmonary embolism, or asthma can all impair oxygen exchange, leaving seniors feeling breathless even at rest. Low oxygen levels can also affect mental clarity, leading to confusion or disorientation, which increases the risk of falls and accidents. Smoking history, previous lung infections, or exposure to environmental pollutants can further exacerbate these risks. It's crucial to notice accompanying symptoms. Shortness of breath combined with swelling in the legs or ankles, rapid heartbeat, persistent coughing, or wheezing may indicate a serious underlying condition. Sudden onset of severe chest pain, radiating to the arm, jaw, or back, accompanied by nausea or sweating, is a medical emergency and may indicate a heart attack. Many seniors mistakenly attribute breathlessness to aging or lack of fitness, but persistent shortness of breath is not normal. Ignoring it can have fatal consequences. Keeping track of when and how symptoms appear, noting triggers, and seeking prompt medical evaluation can help identify potentially deadly conditions early. Early intervention may involve medications, lifestyle adjustments, or emergency treatment that can save lives. In short, persistent shortness of breath or chest discomfort is a warning sign your body cannot afford to ignore. For seniors, it is often a signal of serious heart or lung problems. Recognizing it, responding quickly, and consulting a healthcare professional could make the difference between life and death. Your body is sending an urgent message. Listen carefully. For seniors, sudden confusion, memory loss, or disorientation is more than just forgetfulness. It can be a serious warning sign that something critical is happening inside the body. While occasional lapses in memory are common with age, sudden or severe changes in mental clarity often indicate underlying health problems that demand immediate attention. These cognitive shifts are the brain's way of signaling distress, and ignoring them can be extremely dangerous. One of the most serious causes of sudden confusion is a disruption in blood flow to the brain. Conditions such as stroke, transient ischemic attacks, mini-strokes, or heart problems can reduce oxygen supply, leading to disorientation, memory gaps, or trouble recognizing familiar people or places. Even temporary episodes should be treated as urgent, as they can precede a full-blown stroke, which may result in permanent disability or death if not addressed promptly. Infections are another major cause. Urinary tract infections, UTIs, pneumonia, or sepsis often affect seniors differently than younger adults. Instead of typical symptoms like fever or pain, seniors may present with sudden confusion, agitation, or severe lethargy. These infections can progress quickly, and if left untreated, they may become life-threatening. Metabolic and systemic issues can also play a role. Low blood sugar, dehydration, electrolyte imbalances, or kidney and liver problems can all impair brain function, causing sudden disorientation and cognitive decline. Even medication side effects or drug interactions can trigger memory problems or confusion in older adults. Family members and caregivers should pay close attention to accompanying signs. Confusion paired with dizziness, weakness, slurred speech, or sudden changes in behavior signals a need for urgent medical evaluation. Documenting the timing, duration, and severity of symptoms can provide critical information for healthcare providers to pinpoint the cause quickly. Many seniors and their families dismiss mental changes as normal aging, but sudden confusion or disorientation is never just a part of getting older. Early recognition and rapid medical intervention can prevent serious complications, reduce hospitalizations, and, in some cases, save lives. In short, sudden confusion, memory loss, or disorientation in seniors is a powerful warning sign. It is the brain's urgent message that something may be critically wrong, whether a stroke, infection, metabolic imbalance, or another medical emergency. Paying attention, acting quickly, and seeking medical help can make the difference between recovery and irreversible damage. Your mind is sending a signal. Never ignore it. An irregular or racing heartbeat, medically known as arrhythmia, is one of the most alarming warning signs seniors can experience. While occasional palpitations can occur from stress, caffeine, or anxiety, persistent or sudden changes in heart rhythm can indicate serious underlying cardiovascular problems. For older adults, ignoring these signals can have life-threatening consequences, making it critical to recognize and act on them promptly. Arrhythmias occur when the heart's electrical system, which regulates the heartbeat, malfunctions. This can result in the heart beating too fast, tachycardia, too slow, bradycardia, or irregularly. Symptoms often include fluttering in the chest, pounding, heartbeats, dizziness, shortness of breath, chest pain, or even fainting. Seniors may also notice sudden fatigue, weakness, or confusion when the heart is not pumping efficiently. These symptoms are not just uncomfortable, they are warnings that the heart is struggling to deliver enough oxygen-rich blood to the body. Several serious conditions can trigger irregular or racing heartbeats. Atrial fibrillation, one of the most common arrhythmias in older adults, significantly increases the risk of stroke if untreated. Heart disease, heart failure, or previous heart attacks can also disrupt normal rhythm. In some cases, electrolyte imbalances, thyroid problems, infections, or certain medications can provoke dangerous heart rhythms. Identifying the root cause is crucial because the treatment may range from lifestyle adjustments and medications to more advanced interventions like pacemakers or procedures to restore normal rhythm. Seniors should be particularly attentive if arrhythmias are accompanied by chest pain, fainting, severe shortness of breath, or sudden swelling in the legs and feet. These could indicate heart failure or an impending cardiac event. Monitoring heart rate regularly, noting any unusual patterns, and reporting them promptly to a healthcare professional can prevent complications. Early detection is often life-saving. Many older adults dismiss heart palpitations as just part of getting older, but an irregular or racing heartbeat is rarely harmless. It is the body's urgent alert that the cardiovascular system may be in trouble. Ignoring these signals can lead to stroke, heart failure, or sudden cardiac arrest. In short, an irregular or racing heartbeat is a critical warning sign that should never be overlooked. For seniors, it is a clear signal that the heart is under stress and requires immediate attention. Recognizing these symptoms, monitoring changes, and seeking prompt medical evaluation could literally save a life. Your heart is sending a warning. Listen carefully. Sudden or severe swelling in the legs, feet, or hands, known medically as edema, is a warning sign that seniors should never ignore. While mild swelling can sometimes result from standing too long or eating salty foods, extreme or persistent swelling often points to serious underlying health issues that require immediate attention. For older adults, recognizing this symptom early can prevent complications and even save lives. Swelling occurs when excess fluid builds up in the tissues, and in seniors, this can be a signal that the body's organs are struggling to maintain balance. One common cause is heart failure, where the heart cannot pump blood effectively. This inefficiency causes fluid to accumulate in the lower extremities, leading to noticeable puffiness in the legs, ankles, and feet. When left untreated, fluid buildup can worsen, eventually affecting the lungs and causing shortness of breath, fatigue, and even life-threatening complications. Kidney and liver problems can also lead to edema. The kidneys regulate fluid and salt levels in the body, and when they are not functioning properly, fluid retention can occur. Similarly, liver disease can cause a drop in essential proteins, which disrupts fluid balance and results in swelling. Infections, severe allergies, or blood clots in the legs may also manifest as sudden swelling, and these conditions can be dangerous if ignored. Accompanying symptoms are critical to note. If swelling occurs along with shortness of breath, chest discomfort, fatigue, or rapid weight gain, it is an urgent signal that immediate medical attention is needed. Even swelling in just one leg may indicate a blood clot, which could travel to the lungs and trigger a pulmonary embolism, a potentially fatal condition. Seniors should track changes in swelling, noting how quickly it appears and whether it worsens during the day or with activity. Many older adults dismiss swelling as a minor inconvenience or a normal part of aging, but it is rarely harmless. Persistent or severe edema is the body's way of signaling that organs are under stress and the circulatory system may be compromised. Early recognition and prompt medical evaluation can identify the underlying cause, prevent complications, and guide treatment, which may include medications, lifestyle adjustments, or specialized interventions. In short, extreme swelling in the legs, feet, or hands is a vital warning sign that something serious is happening inside the body. For seniors, it is a signal that cannot be ignored. Paying attention to this symptom, monitoring changes, and seeking immediate medical care can make the difference between manageable treatment and life-threatening complications. Your body is sending a clear message. Listen and act. For seniors, chronic pain is often an accepted part of aging, but when persistent pain suddenly intensifies, it can be a serious warning sign that the body is facing a major health issue. Unlike everyday aches or mild discomfort, a sudden flare-up or worsening of long-term pain is the body's urgent way of signaling that something may be seriously wrong internally. Ignoring this symptom can put seniors at risk of severe complications or even life-threatening conditions. Chronic pain can originate from many sources, including arthritis, nerve damage, or past injuries. However, a sudden increase in intensity may indicate deeper problems. For example, a flare-up in back or abdominal pain could signal internal issues such as kidney stones, gallbladder infections, or even certain types of cancer. Pain in the chest, shoulder, or arm could be a warning of heart-related problems, including heart attacks or angina. Similarly, severe leg or joint pain accompanied by swelling, redness, or warmth could indicate blood clots, which are medical emergencies. It's essential to observe accompanying symptoms. Sudden pain that comes with fatigue, fever, shortness of breath, numbness, or weakness may suggest an urgent medical condition that requires immediate evaluation. In seniors, even seemingly minor pain can escalate quickly, affecting mobility, balance, and overall health. Left untreated, severe pain can lead to immobility, poor nutrition, depression, and a decline in quality of life. Monitoring pain patterns is key. Keeping a detailed record of pain onset, intensity, location, and triggers can provide valuable information to healthcare providers. Early medical intervention often makes a significant difference in treatment outcomes. Sometimes, simple adjustments in medication, physical therapy, or lifestyle changes can alleviate the pain, but in other cases, more intensive interventions may be required to address serious underlying conditions. Many seniors dismiss worsening pain as just part of aging, but sudden changes in chronic pain are rarely normal. The body communicates through pain to indicate that something is wrong. Ignoring these signals can delay diagnosis of potentially life-threatening conditions. Being proactive and seeking prompt medical attention can prevent complications, improve quality of life, and, in some cases, save a life. In short, chronic pain that suddenly worsens is a critical warning sign for seniors. It is the body's way of saying, "Pay attention, I need help." Recognizing these changes, documenting them carefully, and consulting a healthcare professional immediately can be life-saving. Your pain is more than discomfort. It's a vital message from your body that should never be ignored. For seniors, visible changes in the skin, such as bluish lips, extreme paleness, or mottled patches, can be far more than cosmetic concerns. These symptoms are critical warning signs that the body may not be receiving adequate oxygen or blood flow, indicating potentially life-threatening conditions. Unlike minor rashes or dryness, these sudden or pronounced changes signal that internal organs, including the heart and lungs, may be under serious stress. Bluish lips or fingertips, known medically as cyanosis, often indicate low oxygen levels in the blood. This can result from respiratory problems such as chronic obstructive pulmonary disease (COPD), pneumonia, or pulmonary embolism, or from heart conditions like heart failure. When